Hello, this on-demand webinar is delivered to you by Reading Information Advice and Support Service for SEND. It is intended to give you an introduction to education, health and care plans. So what are we going to look at? A basic introduction to the question of what is an education, health and care plan, and when would you need one. We will look at how an application is made and who can make it. The assessment process. This is a 20-week process, so we will consider what happens at each stage during that time. We will give you an explanation of what the different sections of a draft EHCP contain. We will look at the types of schools that can be named, and we'll consider the final EHCP, when it is issued, and what happens if you disagree. Because an EHCP is a legal document, it means that your child has a right to the support that is described in there. As you can see, it will also include any health and care support which relates to the child's special educational needs. For some children, there will not be anything significant to include here, but for other children, there may be a lot to consider in all three areas of the plan. When is an EHCP necessary? In general terms, this would be if the child or young person's needs are such that they need more support than that which can be reasonably provided by a mainstream school. Information about what Brighter Futures for Children expects to be available in schools can be found here. The process would be that an EHC needs assessment would be undertaken to decide if an EHCP is required. This is a legal process, and we will look at the law and statutory guidance later in this webinar. It is important to note that not everyone with special educational needs needs an EHCP. According to government data from June 2021, 3.7% of pupils have an EHCP, but 12.2% have special educational needs but do not have an EHCP. So many children and young people will be supported in school without an EHCP. And if your child is making good progress, then it's likely that they will not need one. Schools have a SEND budget that they can use to fund things like small group or one-to-one work, and this will be planned through the assess, plan, do and review cycle of SEND support. Who can apply for an EHC needs assessment? In many cases, this will be an application made by the school or other educational provider, and the work is carried out by the Special Educational Needs Coordinator. But as you can see here, it is possible for a parent to make their own request. Equally, another person can bring a child or young person to the attention of Brighter Futures for Children. This might be another professional involved with the child. As we've seen, it is possible for a parent to make an application. So what should you do if you're thinking of applying? We always recommend speaking to the school first. It's possible that they may be thinking the same thing as you, and may be in the course of getting ready to make the application. Alternatively, they may still have more things that they can try. They might be planning to involve outside professionals, or they might have new ideas about how to work with your child. By having this conversation with the school, you can make sure that you are making a fully informed decision. The process can be started by you writing a letter explaining why you believe your child has special educational needs and why they might need provision to be made through an EHCP. We can give you some more information about what the letter could contain and also how to contribute your evidence as a parent. Because Brighter Futures for Children needs to have the complete picture of your child, both at school and at home. In terms of other evidence that you might send with your letter, you need to think about what sort of paperwork may help Brighter Futures for Children's understanding of your child's needs. These might include things like letters of diagnosis or professional reports and information from school. What does Brighter Futures for Children need to do once they have a request? Well, they have a 20-week time frame with different deadlines at different stages. So we're going to look at what happens at each stage. In the first 6 weeks, Brighter Futures is not considering whether your child should have a plan, but they are considering whether they are going to carry out a full needs assessment. There is a two-part legal test set out in the Children and Families Act 2014. This says that the local authority, and in this case it's referring to Brighter Futures for Children, has to secure a needs assessment if these two tests are met. The first one is that the child or young person has or may have special educational needs. And the second one is that it may be necessary for special educational provision to be made for them in accordance with an EHCP. Further guidance is given in the SEND Code of Practice on how that decision will be made. As you can see from this paragraph, it concentrates on the action taken and whether the child has made expected progress. So what sort of evidence do they need to consider? Here is a summary of what 9.14 in the Code of Practice says. They are looking at academic attainment and rate of progress. They are considering the nature, extent and context of the child or young person's SEN. They're also looking at what action's already been taken and considering whether, where progress has been made, it has only been as a result of additional intervention over and above what is usually provided. The list continues here with evidence of physical, emotional and social development and health needs. And there's a particular consideration for those young people over the age of 18. What will happen at the 6-week point? Well, you will find out whether an assessment will be carried out, and if not, why it will not be carried out. If the answer is no, there will be an opportunity for a meeting to discuss the decision and/or for formal mediation or an appeal. We always recommend discussion, whether formal or informal, before deciding whether to take a legal route. Assuming that a decision to assess has been made, you now move to step 2. The SEND Code of Practice sets out who should be involved. Obviously, the child's parent, and wherever possible, the child should be involved. It is very important to gather the child's views if at all possible. There is input from education and an educational psychologist. And then a wide range of other people may be involved depending on the needs of the child. This might include healthcare or social care professionals or others that Brighter Futures for Children considers appropriate. And there's a 6-week period for these professionals to provide their reports. You might wonder whether it means that there'll be new assessments and reports. Not necessarily. It doesn't necessarily mean starting all over again with the evidence. If everybody is in agreement that the evidence is still relevant and accurate, then the existing reports and assessments can be used. What about your involvement in the process? Well, you will have already given some views at the start of the process, and you may find that you have a co-production meeting with the Brighter Futures for Children case officer and possibly the school and others to look at the possible outcomes that might be put in an EHCP. So we're considering what that document might be trying to achieve for the child. This information would still be useful and relevant if an EHCP is not subsequently issued. You then move to step 3, where there may be a decision to issue a plan, and if so, you will receive a draft plan. So this is a decision that is taken by week 16. You will be given the decision with reasons if it's a no. If it is a no, you can have an informal meeting to discuss. Again, consider mediation or an appeal. If it's a yes and you're issued a draft plan, you have time to consider its contents and make your views known. And at this point, you will also be asked if you have a preference for a particular school. What can you expect to see in this draft plan? Your views, interests and aspirations will be reflected in section A. Parts B, C and D concentrate on the needs of the child. Part E sets out the outcomes, what the plan is hoping to achieve. And sections F, G and H explain the provision, i.e. the support needed to meet those needs that are set out in parts B, C and D. We will look at that a bit further in a moment. Looking at the remaining sections of the EHCP, section H1 is social care provision under the Chronically Sick and Disabled Persons Act. This might include support at home, support to access the community, and help with adaptations to the home. Section H2 is any other social care provision that is related to the special educational needs or to a disability. This might include short breaks or adult social care. Section I contains the placement, which will include both the name and the type of school. This is not included in the draft plan and will only appear in the final plan. Section J contains details of any personal budget for education, health or social care. And Section K will be the appendices, which are all the reports that have been relied upon in creating the EHCP. Now we're going to consider some of the key things to think about when looking at your draft EHCP. Section B will contain all the special educational needs, and there should be corresponding provision in Section F. This needs to be quite detailed and specific and normally quantified, for example, in time and frequency of support. An example might be, Charlie requires 20 minutes per week, small group work in a group of no more than 6 children to help with his social skills. Information about what is required should be in the reports that fed into the plan. As you can see, any health or social care provision which educates or trains should be in sections B and F, otherwise they will appear in C and D. An example is speech and language therapy, which is usually considered to be special education provision. Having a brief look at outcomes. You will recall that the EHCP contains outcomes, and you will find these in section E of the plan. 9.66 in the SEND Code of Practice explains what this is, as a benefit or a difference made to an individual as a result of the intervention. So here are 2 examples. By the end of Key Stage 2, Sophie will be able to work independently for at least 50% of each lesson. Another example, by the end of Key Stage 1, Mohammed will be able to engage in a daily play activity with another child. So what we're looking at here is what it is hoped that the child will be able to do that they currently cannot do. In order for an outcome to be effective, it should follow these principles. It should be specific, measurable, achievable, realistic, and time-bound. We now come to step 4, which takes place in weeks 18 to 20, and this is the stage where naming a school happens. So we're heading towards the end of the 20-week process, and this is a big decision. For many children, they will remain at their current school, but some may move to another school or even a different type of school. The question then arises, what are the options? So Section 38(3) of the Children and Families Act states that you can request any of the following. The first 2 listed here are standard state schools or nursery schools. The third one, non-maintained special schools, are schools which are not maintained by the state but charge fees on a non-profit basis. Often these are run by large charities. Then you have further education or sixth form college, and lastly an institution approved under Section 41. These are approved independent special schools and post-16 institutions. If you have requested a particular school, then Brighter Futures for Children must agree with your request unless it can show one of the reasons listed here from Section 39 of the Children and Families Act. The first one is based on the needs of the child. It may be that a school is unsuitable for your child because of the particular learning levels that they have or behavioural issues. The second one relates firstly to incompatibility with the efficient education of others. So perhaps the behaviour of the child would affect others in the class who don't have those types of issues. The other reason listed there is that it's incompatible with the efficient use of resources. Perhaps the school is very expensive or far away, and Brighter Futures for Children feel that needs can be met locally. As they're using public funds, they must consider what will be best value for money. Some parents feel very strongly that they want their child to have a chance of trying mainstream education. This section of the law supports this view. What if you would like your child to attend an independent school? You cannot legally request one, but you can make representations for why you would like one. As you can see, an independent school has a choice about whether they take your child, unless it is on the Section 41 list mentioned earlier. And again, the question of it not resulting in unreasonable public expenditure arises. In terms of considering the suitability of schools, we cannot recommend schools to you, but we can tell you what is available locally, not just in Reading Borough, but in surrounding local authority areas. Lots of parents take into account the views of other parents, and this can undoubtedly be helpful, but do bear in mind that what works well for one child may not work for another. Every child is unique, and you know your child best. So you might be thinking, how can I decide? This is quite complicated. We would recommend that you look at the local offer. There is lots of information available on there. If you are able to visit a school, that can be really helpful. It gives you an opportunity to have a feel for the school and to talk to a member of staff about any questions you may have or concerns that remain. We do have a guide on our website, and the link is here. This will give you some things to think about and some questions to ask. So now you come to the end of the 20-week process and the finalising of the plan. The plan will be sent to your school of preference, and they should respond within 15 days. And then the plan will be finalised, and this will name both the type of school and the name of the school. There may be different points in this process at which you disagree with a decision made by Brighter Futures for Children. So what happens then? You will have legal rights throughout the process, and your decision letters that you receive will explain your right to appeal and to seek mediation. We always recommend that you keep talking and trying to resolve matters without going straight to legal recourse. We can support you throughout these processes.